From breath to breakdown, how cellular stress appears years before disease planning. The silent years. Most chronic diseases do not begin with pain. They do not begin with abnormal scans. They do not begin with a diagnosis. They begin quietly, at the level of molecules, long before arteries narrow, long before blood sugar spikes, long before memory fades. Cells experience stress, and that stress leaves a chemical trace. In the previous episodes, we decoded acetone, isoprene, and ammonia, metabolic messengers in your breath. Today, we go deeper. We explore how oxidative stress and cellular inflammation generate volatile compounds that precede visible disease. Because the body does not collapse suddenly, it drifts. And drift can be detected if we learn how to listen. Section 1: Oxidative stress, the cellular spark. Every cell in your body produces energy inside mitochondria. During this process, small amounts of reactive oxygen species ROS are generated. In balanced amounts, ROS are not harmful. They are signaling molecules. They regulate immune function. They help adapt to exercise. They maintain cellular communication. But when ROS production exceeds antioxidant defense capacity, oxidative stress begins. And oxidative stress is not abstract. It has chemical consequences. Lipid peroxidation. When membranes begin to break, cell membranes are composed of phospholipids, fatty molecules forming protective barriers. Excess ROS attack these lipids. This process is called lipid peroxidation. When lipid peroxidation occurs, it generates volatile compounds including alkanes and aldehydes. These molecules are small. They are volatile. They diffuse into blood. And eventually, they exit through breath. Aldehydes may reflect oxidative membrane damage. Long before structural injury becomes visible on imaging, this is where chemistry proceeds. Pathology. Section 2 of the early chemistry of cardiovascular disease. Cardiovascular disease is often framed as plaque buildup, but plaque is the late stage. The earliest stage is endothelial dysfunction. The inner lining of arteries becomes inflamed. Nitric oxide signaling declines. Oxidative stress increases. Lipid oxidation begins. During this early phase, Isoprene patterns shift. Lipid peroxidation byproducts increase. Inflammatory VOC clusters changes before a coronary artery is blocked. Breath signatures may reveal vascular stress before symptoms ever appear, not because the artery is closed, but because metabolism has shifted. Section 3: Prediabetes, the invisible drift. Before fasting, glucose rises consistently. Before HbA1c crosses 5.7%, before doctors use the word prediabetes, metabolism begins to change. Mitochondria struggle to handle glucose efficiently. Insulin receptors become less responsive. Fat oxidation patterns shift. Inflammation increases subtly, and oxidative stress rises. This metabolic inflexibility generates distinct VOC patterns, altered acetone variability, increased aldehyde shifts in ketone dynamics. Brief may reveal insulin resistance years before blood tests cross diagnostic thresholds, because thresholds are arbitrary. Metabolic drift is continuous. Section for neurodegeneration begins in chemistry. Neurodevelopment. Diseases like Alzheimer's are often diagnosed when cognitive decline becomes noticeable, but pathology begins decades earlier. Mitochondrial dysfunction, oxidative stress, chronic neuroinflammation, lipid membrane damage, all of these processes produce volatile byproducts. Emerging research suggests specific breath VOC patterns may correlate with early neuroinflammatory changes. This does not mean breath replaces brain imaging. It means breath may indicate risk trajectories earlier, before sepses are irreversibly lost, before memory noticeably fades. Section 5 Chronic inflammation and the breath profile. Grade chronic inflammation is the common denominator of most modern chronic diseases. Obesity, cardiovascular disease, type 2 diabetes, autoimmune disorders. Chronic inflammation alters metabolism at the cellular level. It increases oxidative stress. It shifts lipid handling. It modifies amino acid pathways. These shifts produce measurable VOC signatures. Breath may become a systemic inflammation monitor, not by measuring cytokines directly, but by detecting metabolic consequences. Inflammation is not silent, it is chemically expressive. Section 6 The timeline of disease. Let's visualize a timeline. Year 0 Metabolic resilience. Year 5 Mild oxidative stress. Year 10 Endothelial dysfunction. Year 15 Plaque formation. Year 20 Symptom onset. Year 25 Clinical event.